Bolwidaka, I know we've started this announcement late again, but as I've mentioned before, we test for the virus non-stop 24/7. Unfortunately, positive cases don't come about at convenient times. So this morning we thought that we were going to have a good day. Towards the end of the day, then we have to sort out some late developments, which has brought out some important changes to our strategy. So we've spent the afternoon trying to ensure that we can communicate these changes clearly to the nation. Before we get started, I know that many of you are concerned about the health of our current COVID-19 patients. I can thankfully report that none of our current active cases have deteriorated into severe illness. We are attending to them closely to make sure that they have the care they need, and we can confirm that they are stable at present. I'm afraid that's about the only comforting news that I have to share today. After the 605 cases in the past 24 hours, we have 5 new cases of COVID-19 to report in Fiji. The first 2 are close contacts of our previously announced cases. They had tested positive while secure in quarantine facilities. One is a 25-year-old wife of the case who lived in Wunimono, Nosori, and the other is his 52-year-old aunt. The third case is a former quarantine passenger who traveled from Papua New Guinea into Nadi on the 9th of April, Friday. He had 3 negative pre-departure tests before leaving Papua New Guinea and tested negative twice while in the Tanoa Hotel quarantine facility before being discharged on the 23rd of April. He was re-swabbed in Navua as part of our investigations into the quarantine breaches at the Tanoa facility and has subsequently tested positive. He is now in quarantine. We can confirm that he had contact with case number 95, the husband of Our Lady living in Makoi, on the day of his discharge from Tanoa quarantine facility. Again, this case shows how punishing any lapses in a protocol can be, in particular when you're dealing with a highly transmissible variant of this virus. We have identified 98 people who are discharged from Tanoa quarantine facility between April 12th and April 25th. 82 of these persons have been contacted, told to stay home, and we are repeating the test on them. And the remaining 16 have already been contacted and are in the process of getting the test also. The fourth case is a 68-year-old male in Reki. He tested positive after presenting to the Reki outpatients department with cough and fever. We are yet to establish any direct link between this case and existing cases. Investigations are ongoing, while this individual has been entered into quarantine. We are quite sure there are others like him out there. Anyone who is feeling unwell anywhere in Fiji should report immediately to a screening clinic. The fifth case tested at is a border quarantine case. 23-year-old male who traveled from Guyana to Fiji. He arrived on our last flight into Fiji, that was on April the 22nd, through NZ 952 from Auckland. He's actually a Tongan national and is on his way to Tonga. He tested positive while undergoing mandatory 14-day quarantine at a border quarantine facility in Nadi. Now, contact tracing for these new cases is underway. We are most concerned with the aunt from Wunimono, as she worked in a garment factory. Her place of work had been shut down since we announced our restrictions on Monday, and we are screening anyone she's worked with while she may have been contagious. We have contacted the management of the factory she worked in and the factory that is next door to it, and these managers have agreed to work with us to ensure that their workers are urgently screened tonight. Our plan tonight is to have my teams go house to house and swab as many as possible, at least 80% of them. As that investigation progresses, the same principles will always apply. health restrictions may expand or become more stringent, or we may have to put in more stringent lockdowns depending on the results of our investigation. And we will be able to update you more in the morning. As I speak, there is a group from both government factories sitting in the room next door, going through a map and working out where all the workers live. Both the government companies have given us vehicles to work with, together with the vehicles that we have, together with the medical team that we will mobilize, and all of tonight it will be an all-night operation. Meanwhile, our 110th case, who's living in Rekereke, still does not have a clearly established connection to our existing cases. However, thanks to contact tracing, we have leads, and until we are confident enough to make an official confirmation, our Fijians should continue to behave as if they have been exposed to the virus. Boundaries in Ra have been set. The patient's family are now in quarantine and have been swabbed for testing. We also swabbed another 40 primary contacts of this individual and screened 406 others in Ra. Results are pending. Meanwhile, case number 111, the case from our Makoi cluster that traveled to Vunimono, is also of high concern because of his extensive travel history since April 14th when he was first exposed. That's over 2 weeks of moving around Viti Levu. So our contact tracing team are working in overdrive mode to determine and contact everyone he had been encountered with, and those to whom we feel that he is a risk to. We hope that the risk of transmission was lessened by the fact that he, at no point over the last 2 weeks, displayed COVID symptoms. But hope is not a strategy. Because he was engaging in higher risk activities like drinking grog, sharing cigarettes with friends and family, others may well have been exposed to the virus. We simply cannot take any chances. Taken together, these last cases and existing unknown point to the widespread transmission in the community, we believe can be an early part of a fast rising upward curve in case numbers. Most Fijians are already taking this threat seriously. You have our thanks. But most of us is not enough. Every Fijian must act responsibly. Wash your hands, stay at home. We still have too much movement among the public. Today I went around, driving around, I went up to Makoi. There's way too much movement in the afternoon in Makoi. I could see shops that were still crowded. It's very unfortunate. Please stay at home, stay still. That's the one measure that matters more than any other measure. Stay home. It is where all of us are safest. And if there's one message I ask everyone watching to help us spread, it is encourage others to please stay home. If you have an absolutely essential reason to leave the house, wear a mask at all times. Turn on your Care Fiji app everywhere you go. If you feel unwell, call 158 or visit your nearest clinic. If you see crowding, don't add to the problem. Stay away. Stay away as if your life depends on it. It may very well be. Crowds aren't always easy to predict. We know that we have some crowding issues today outside of this building. We will lead by example by offering the service from different locations, and we're moving more of our services online. Essential businesses should follow that lead. If you see crowding, shut your doors, or we will have to ask the authorities to assist you. In the meantime, our mass public screening is benefiting from people staying at home. We completed the first round of screening in Narere and Cunningham. And for Wainivula, the Umbati, Tadiriwa, Makoi, we have finished 95% of our target population in those areas, with about 144,747 people screened across Viti Levu and many more thousands to go. These screenings do work, especially at identifying high-risk contagious cases of COVID-19. But just because you've been screened doesn't mean you are clear to flaunt any of our restrictions. Remember, screening is different from testing. It is far from effective as a proper 14-day quarantine process. That is why we will be screening our high-risk areas multiple times, as someone screened once may become a viral carrier days later. So let me repeat that. This is why with all our high-risk areas, we will be running a screening program multiple times. So if you go to Tavakumbu, if you go to Cunningham, and if we are up at Makoi, the screening program will run back and forth over a number of times over the next 14 days. That's the way we are planning to do our screening, especially in the high-risk areas. And in the lower risk areas, that the immediately areas that surround it, we are planning to make sure that we at least run through it twice as part of our screening program. Yesterday I saw some photos of people having a picnic in Lami. It was one of several high-risk areas in the country. Mostly young people. They were having a bit of a lockdown party. That should not have happened there. In fact, it should not have happened anywhere. Gatherings are not allowed for the simple reason that congregations of any size can become super spreader events. In one photo, I counted 19 young people all piled on top of one another trying to jump into the photo. Mostly young people. Even if one of them was carrying COVID-19, that could easily have resulted in 18 more new cases today. Young people are generally thought to be at a lower risk of severe COVID-19 disease. But that does not matter. They are not immune. We have seen from other countries that once a large outbreak takes hold, everyone is affected. Young people can end up being hospitalized and they also can die. Many of us share homes with multiple generations. We have children, parents, and grandparents all under one roof. A young person carrying this highly transmissible variant of the virus from that picnic to their parents or grandparent would actually cause the death of one of their close relatives. This is a fact. Something as simple as a picnic could get people killed. That is why I'm asking every mother and father in Fiji to please keep your children at home. The schools are closed. The children are under your care. It is simple. Just keep track of them and do it well. As mentioned yesterday, travel through containment areas is highly restricted. We are not issuing day passes to anyone with regular travel across borders. In fact, the last 3 or 4 days, I've struggled by telling people that I had asked them to move into their containment zone of work over the last 3 or 4 days. And still, by this evening, I still get requests, please, can I go back and forth? We have developed new protocols around funeral arrangements. Deaths are never planned, so funerals are sadly unavoidable events. When death does occur, we will allow the body to be transported to its final resting place through containment area borders. However, we will only allow the vehicle with one driver to cross the border, and that driver must have Care Fiji installed and turned on. The driver will be escorted by corrections officers to ensure that they remain in the vehicle in the entire time they are within the containment area. Let's not forget, this outbreak started at a funeral. When these events are held, we all have to be very disciplined about wearing masks, maintaining physical distance, and ensuring no more than 20 people attend. We've also drafted SOPs for the cartage of essential goods. Within containment zones, the movement of food and essential items does not require approval. Drivers should, however, wear masks and regularly sanitize their hands. They may carry one passenger to assist with deliveries. This passenger should also wear a mask, maintain physical distance as much as possible while unloading goods. Every single driver and passenger must have a Care Fiji app downloaded, and it must be switched on the entire time they are within the containment zones. no exceptions. Now, between containment zones, this requires approval to transport food and essential items. Requests for passes can be emailed to COVID Pass MOH, COVID Pass MOH @gmail.com. I hope that's easy enough to remember for everyone. If you are approved for deliveries, drivers must wear masks, regularly sanitize, and keep a physical distance of 2 meters from others. Again, Care Fiji app must be installed and on for the entire day of work. While within the containment zone, the driver must not disembark the vehicle. They should not lower the windows. Loading and offloading must be carried out by individuals at the delivery destinations. And we will be publishing full guidance of the containment zone deliveries on our ministry website and the Fiji government Facebook page. These and the rest of our containment protocols can be demanding, we know that. These restrictions are very nearly measures of last resort. They are only in effect because life depends on them being enforced. We do not recommend these measures that we are taking lightly. When I said these restrictions are nearly measures of last resort, that means there is a last resort. And the last resort is when we say full lockdown. Nobody move, nobody do anything. It is just out of the concern for the welfare of some of our people that I need to allow some degree of access, especially to food, fuel, and freight. That's the only reason we're moving a little bit. Even with COVID in our midst, Fijians still need medical care to treat a range of illnesses, some of which are as deadly, if not more, than coronavirus. Our hospitals are open, and care is being provided in a manner that does not pose a risk of viral transmission. But we do face some shortages of essentials. Some are beyond our control because of the global supply chain disruptions. There's one, however, that we can resolve together. Right now we face a shortage of blood for transfusions. I want everyone to know, if you can donate blood, it is safe to do so. If you've been partially vaccinated, you still can give blood. So please keep an eye out for opportunities to do so. We will make sure that these details will be publicized widely. My teams will work through the night to give us a clearer picture of where we stand with regards to these new cases. If any of you are called upon, please cooperate with them. They are there to help. Dr. Alicia will give another update for us, after which we will take some quick questions. Thank you.
Thank you. So as just announced by the Permanent Secretary for Health and Medical Services, we have 5 new cases to report. I'm not going to go into the details of those cases as he just has done that. So with these latest cases, we have now 49 active cases in isolation. 5 are older border quarantine cases that were announced before Sunday, April 18th. 14 are recently announced border quarantine cases. 28 are locally transmitted, and 2 cases are currently under investigation to determine the source of transmission. So in total now, since our first case was recorded on March the 19th of 2020, we've had 116 cases reported for Fiji. With that, we've had 65 recoveries and 2 deaths. In terms of testing, we've done a total of 49,996 tests since we first started testing for COVID-19 early last year. And we have a daily average of 784 tests per day over the last 7 days, and a weekly average of 3,485 tests per week. That's over the last 2 weeks. And then, of course, last week we hit a record of over 5,000 tests. So testing, of course, has increased in line with our recent response to cases, and 605 tests were conducted yesterday. Our test positivity is at 0.2% overall, and our 7-day average daily test positivity is at 0.6%. Thank you.
Thank you very much, Dr. Alicia. Follow-up question. Dr. Fong, Semi Turanga from Legend FM News. Will you be able to tell us the location of that garment factory?
We looking at Lyndhurst and Makwan. Makwan. Yes, it's all in Makoi. As I mentioned, they in the next room next door. They are being very proactive in assisting. Again, I emphasize the fact that it's not their fault. The disease just went there. Now they are acting really fast to try and make sure that tonight there'll be a lot of people staying awake, coming around to do swabs. And by morning, we should be having some results from some of the swabs that we can run throughout the day.
How many employees in that garment factory are we looking at?
They just came in about, I think about 3 or 4, 3 o'clock? Yeah, about 3 o'clock they came in and they started discussing. I haven't been into the room yet.
Okay.
I've been trying to prepare the words for this press conference.
Lena Reese from FBC News. Dr. Fong, very quickly, you mentioned the man from Ra yesterday, that you were still trying to ascertain how it is that he had contracted the virus. Would you have any updates as to whether or not this has been ascertained?
From the preliminary data we got, we have some clue, but I think it's, like I've just said before, we'll only release what we have verified. And if the clue is not enough, then of course we've discussed this morning about sending his specimen across overseas to see if it is similar genetically to one of the viruses that's moving around.
The night before last, you mentioned that they were still in the process of suing a response as to what would happen to those soldiers who had breached the COVID-19 protocols while they were in the border quarantine facility. Has there been any update as to what the response is because they breached those protocols?
I think we've contained them. We've kept them where they are right now. There is one group of soldiers who have been stood down, but further action will have to happen after we finish our containment program.
Dr. Fong, Arietta from the Fiji Times. What measures have been put in place in vulnerable places such as informal settlements where the risk of this virus spreading could be much higher?
Yes, that's a good question. I know that, as I mentioned, we especially around the areas where the localities where there is a lot of crowded people, we have to do house to house. It's house to house screening and swabbing. And our swab strategy is almost like everybody who stays within the vicinity of one locality we swab. That's why our numbers are very high. And then after that, when we go on the outside, and then we're looking for fever and symptoms before we swab. Further than that, our part is the containment, seek and contain. That's our part, medical people. Then we rely on the compliance of our people, which is practically almost 70% of the effort, for them to make the goalpost move closer by keeping still. Because if they keep still, the goalpost will come closer and our containment program will go over. If they keep on moving, the goalpost will go further and our containment program will be before that.
Dr. Fong, before I go on to this question, Lindus is in Colombo or Makoi? I understand it's in Colombo, eh?
Is it?
Because you said Makoi.
Oh, yeah, sorry. It's yeah, you're right.
Colombo.
I actually drove into that place.
Yeah.
You're right. It's
in
just
Colombo,
at the back of Valelewu and
Yeah.
at the back there. Yeah.
Okay.
The tax-free zone. Yes.
Right. Okay.
Yes, yes.
And another question here. It's on those screening mechanisms you're talking about for people moving from one containment zone to the other. Explain that very specifically for me, because there is a real concern out there. For example, if you are in the Suva containment area, you don't want a COVID carrier coming from the Lami containment area. It would really defeat the purpose of it being a containment area. So if that's a driver in one truck coming through, they're not closing any doors or anything.
Yes.
When they go back, what happens then? Do they stay home for 14 days?
Yeah.
Or do they continue with the next shift the following day?
Okay. What we've done is that if you're moving from your source containment area out, you have to be from a low risk area. That's the first thing. Once you're in the truck, you're not allowed to move out of your truck. Okay? When you see there'll be spotters around to watch all this program, and we've got a good network of spotters to sort this out. The punishment is quite severe. It's already been legislated. Unfortunately, that is the easiest way that we found to try and move food, freight, and fuel around. It is really important that we move these three commodities. Because as I mentioned, there's a delicate balance. If I don't have these three commodities, then we can't maintain the lockdown. The lockdown gets broken by the people in their search for these three commodities. So there is a delicate balance that we have to enforce between the conditions that we impose to restrict the movement of these three commodities and the requirements of the objective of the lockdown, which is to stop transmission. As I said, our main risk assessment is from the source point, source where you originate from. We just have to make sure that you're not coming from any high-risk place. After that, when you're moving, you're supposed to stay in your car with your mask and you do all your COVID-safe measures.
What are you telling businesses of the employers of these truck drivers and all,
Yes.
these drivers when they return from that particular containment zone? What happens then?
Oh, no,
do they go straight home and isolate for a certain period, or do they continue work again the next day?
No, they continue, because technically for us, they have moved from their house and through low-risk zones.
Okay.
They have stayed in the truck. They have wound up the window, and technically for us, it's almost what we call a quarantine corridor that we have maintained.
Okay.
And they've kept themselves within that quarantine corridor. We have measures to check to make sure that they have not jumped out. And of course, the penalties are quite severe if they have jumped out.
Dr. Fong Merioni from Fiji One. What measures is the ministry taking in terms of street dwellers? The street dwellers, those on the streets, the people on the streets. Our team visited some of them today.
Okay.
Just
Yeah, from what I understand, there's a separate group of people who have been dealing with the street dwellers and supplying them food and putting them in contained spaces. They cannot cross borders, but they have places that they are known to go and sleep in. And that to us it's okay. As long as they're getting supplied with food and nutrition, we feel that they're okay. The thing is that it's not like there's a huge crowd of them. So when the streets are empty, it looks empty because then they're well spaced apart. So we do have quite a lot of compassion for that group.
Dr. Fong, you mentioned that we're expecting an upward increase in number of cases, given the extent of the travel history, based on travel history in context of current cases. What are we preparing in terms of quarantine facilities, isolation centers to cater for that?
We, as I said, we've got the surge policy is always to create more beds. So we have converted a number of schools, and we're in the process of converting a number of schools into quarantine facilities. We haven't used them yet. We still got our own current facilities in Doloisuva, the one in Navua, and there's one more that I can't remember. But they are they are the ones that we had already arranged. But while we're doing that, we're also setting up a few more other quarantine facilities around.
Dr. Fong, on passes again,
Yeah.
we were at the border We've been at the border for the last 3 days and again today. We've noticed taxis crossing. You're the one giving approval for the passes. What's the situation with taxis? It appears some of them are carrying passengers across and coming back empty.
I did see that this afternoon also. And I must admit, I'm a bit puzzled about that one. Yeah, that was my intention tonight to have another look at this particular area. I mean, I stood in the one near Rups Big Bear, the junction at
Rups Nakasi border,
yes,
yeah.
Rups Nakasi border. And I did see some taxis moving. It puzzled me. I went to check the papers, but I think, on the road is not the forum for me to bring it up. I need to bring it up in the main task force forum that we have at 10 o'clock. And I'll ask the relevant people and see if if that is a necessary travel. I'm mindful of the fact that there are some passes being issued from here. Maybe some of the passes are issued and we are not aware of the nature of the travel. We're only aware of the business that they are wanting to go and sort, and it's considered essential travel. So we'll have to go. I'll have to investigate that particular point. I observed it this afternoon. Definitely did.
Dr. Fong, another particular area that is of great interest to a lot of people are vaccinations, and today we have been informed on good record that there were vaccinations being carried out here in Turek at the QVS Old Boys Club, and I understand that quite a number of people were there to get vaccinated, and it's a great thing that people are getting vaccinated. However, the initial information about this current batch that's here is that it would be for frontline workers who missed out earlier, as well as PSV drivers, parliamentarians, so forth. Is there some kind of misinformation as to who is the target area with this current batch?
Yes. This 20,000 that we said we've left up at 20,000 doses we left in the West. That's to be deployed amongst that group that I'm talking about. The bus drivers, the taxi drivers. We're hoping to talk to peak bodies of bus drivers, taxi drivers, and minivans to make sure that they all get a shot. We are looking at the highly mobile people, the people who still work in highly mobile industries. We bought 4,000 to QVS Old Boys Club. They don't routinely serve vaccines, but we decided they have to serve vaccines today. And they were able to give, they gave it mostly to the medical people who had not yet been vaccinated. I think some of the doses were given to some of the journalists. I hope all of you have had your first dose. If you haven't had one, think wisely, do wisely, get vaccinated. We actually are anticipating a couple more doses, a couple more batches coming in very soon. And when I say very soon, I mean extremely soon. I just need it to be confirmed, and then I'll be able to announce it.
Just in light of the current situation, I understand there are confinement areas and so forth, and with this vaccination rollout and the Ministry of Health trying to ensure that everybody eligible gets vaccinated, is there any possibility that the Health Ministry is looking at the possibility of door-to-door vaccinations?
We'll have to consider it. That definitely has to be in the strategy. I mean, the ones that are coming in, I'm hoping will have a very long expiry date. Usually for us, all the vaccines, the day they get, from a certain date when they are manufactured, the expiry date is about 6 months. And then they take the while to come. If they come here after 1 month, then we got only 5 months. If it reaches here after 2 months, then we got only the balance left of months. But from the initial discussions I'm having, it looks like we might be having some with a longer expiry date, and that will give us a lot more opportunity to do one-on-one vaccination together with the screening.
Any questions from Fiji Times and ITV? No, please come forward so we can request the mic.
Dr. Fong, have you received any reports of people who had taken the vaccination and that they later developed some health conditions?
We've received reports of people who have side effects. I know. I mean, even my sister-in-law, all my sisters have all side effects. For some reason, the side effects are more in the young girls than in the older people. But otherwise, we haven't had any side effect of note. You know, the one that we really get worried about. We haven't had any documentation of such. I know somebody did mention, there was somebody who mentioned that there was a side effect that went on for 2 weeks, but we waited for the details, it never came.
Dr. Fong, just the final one from me. Tonight, you mentioned full lockdown. And I know you talked about that in your speech. Not that we're having a full lockdown, but you said we might have to resort to a full lockdown, right? What will that look like for us? Are you able to just tell us that? Because a lot of people wonder what that will look like. I know you said no movement. Would that mean purely only essential services will run? And would it be a situation where you see no one walking at all on the side of the road? And I ask this, and this is the context for this question. You talked about seeing still a lot of people moving around today. You talked about that lockdown party.
Yeah.
And of course, that list also of those 10 high interest areas coming out today from the Ministry of Health.
Yes, your observations are absolutely on point. That when I walk around, I feel a little bit depressed. When I see what I saw today, I get depressed, and every day I walk out, I'm not happy. I see the number of cases that are coming out. So what we are trying to do is that with our running around today, we do swabbing, and after that, then we'll get out. If there's any more positives coming out, we check their history. And if we think that we are getting to the point where the movement, any movement, is shifting our goalposts too far from us, then yes, we will definitely ask for the lockdown that you just described. Nobody moves. We're absolutely illegal for anybody to stand even on the side of the road. It will be completely out. You stay in your house, of course in your compound, but not in any public space. And then the only people moving around will be the screening teams, the ambulance taking sick people. The thing is that in order for us to go into full lockdown, we really do need to start sorting out things like food supply. How can we preposition essential items for people just to come out quickly, get it, and go back in again? See, all those logistics has to be thought about. That's why I'm still holding a little bit back, and a few of us, I mean, when I say I mean there's a big group of us who are thinking about this. We're thinking very carefully. We don't want to stop one thing and incur the adverse effects of other things. So I think we're running a fine line here, but I think we do have some leeway towards more stronger enforcement of the lockdown, provided we preposition essential goods to be available, as when necessary.
We'll give the floor for final 2 questions.
Dr. Fong, the ministry has identified some areas of interest. Have the ministry contacted the management and property owners and indicated their risk? These businesses are BSP, the one that was released today, this afternoon.
Oh, I think you can answer that. Yeah.
Thank you. So as noted in the publication that went out today about the list of places, with these places, quite a number of contacts have already been identified from these places by our response teams. This is just in case there are people out there who have been in these locations at the times that we've specified, and they haven't been contacted by our teams. So if you haven't been contacted by our teams and you've been at one of these locations on the specific dates and times, we're asking that you stay at home for one thing, quarantine yourself, and call 158. Thank you.
One last question.
Just while we're on the math areas that have been identified, They're very popular spots, attract a lot of people. How confident is the Ministry of Health in actually being able to get everybody that may have visited these areas?
Yeah.
Yeah. We are as confident. I mean, we are confident as long as everybody's keeping still. I mentioned, I'm glad somebody did ask me about moving people and what it means. And I did mention about goalpost. You know, in one high-risk area, if I can keep the goalpost like this and then we go around it, we set. If people move, then it's a problem. Right now, I am fairly confident with the ones that we have had. There are a number of factors, it's a bit too difficult for me to explain, but there are a number of factors where we feel that we have some degree of containment in regards to the high-risk groups that we have seen and found. We've had, well, you know, when I'm explaining over here, sometimes I highlight all the negative bit a little bit in terms of the containment and the poor compliance and all that. But I can assure you there are so many people who actually comply. There are many people who are actually jumping up and saying, yes, I need to be screened also. It's just that I need to, my problem is those who are compliant are not the problem. It's the incompliant that's our problem. And that's why my message always come out to try and target the incompliant. As I said, I'm fairly confident. It's just, I know the nature of this virus and it's a highly virulent one. And if given some of the observations that we had today, if the movements that I saw today doesn't seem to curb itself, and maybe, and together with a number of positive cases, if our positive cases keep on escalating from the ones that we see, then definitely we will have to start looking at stopping all movements so that the goalpost just doesn't move, and that gives us better chance to move around.
Thank you very much, Dr. Fong and Dr. Alicia. Thank you again, members of the media that also concludes our press conference for today. Now,